Are people getting scammed enrolling for Medicare?
Absolutely. And they're also facing the danger of abuse and exploitation.
Oh, man. Okay. Interesting information. Medicare enrollment's coming up. That's our subject for today's Joe Knows Better. I'm Joe Ducey with the Better Business Bureau, and this is Joe Knows Better. All right, I'm here with BBB's Michelle Marin.
Hey, Joe.
Thanks for being here, Michelle. And Carol Brown with WACOG, the Area Agency on Aging. And we're talking about Medicare. The enrollment's coming up. A lot of people interested in that. And, you got our attention because we were at the Attorney General's office when they have a task force involving seniors. And when they came up about Medicare, a lot of the people from the various areas, including you, were saying, yeah, people are getting scammed and misled.
Absolutely.
That's what's happening in here. And we're going to get into Medicare and all these things, but let's start with that, okay? What's happening to people and what have you seen people face when they have not gotten the Medicare they should have gotten?
So imagine if you've signed up for a plan, trusting whatever source reached out to you, and you then find out that the coverage that you need for your particular health circumstances isn't available, including if you made a switch and you're in the middle of treatment, perhaps for cancer care, and your new policy and your new coverage will not cover it. And it's now going to be out of pocket because you've made the choice for that plan for the coming year. It has been devastating to people who have taken a loss like that.
And you've seen that happen?
Yes, throughout the state, we've certainly not personally by me, but through the information that we share amongst those that advocate in this area and our area agencies on aging, absolutely.
So what's happening?
Well, picture, and I fully believe in advertising and folks running a business and being successful, but picture those postcards and those mailers that come and deluge our older adults at this time of year. Commercials nonstop, on the radio, on the TV, phone calls, soliciting assistance. I'm already getting calls from people who want to help me with my Medicare coverage.
Yeah.
Well, they don't always have your best interest in mind. And going to dinner at whatever local restaurant that they've set up their meeting dates for, I promise you that free dinner is not worth what could come out of that, which is a company that has to make money. They need to make a profit, and they're at times going to try to put you into a plan that is not what's best for you, but it is what's best for them.
Okay.
It happens. Not everyone does that, but there are those out there that are that unscrupulous that they are more worried about what they are going to make as opposed to what it could do to that individual that will be set up on that Medicare plan for the coming year.
Okay, and some of the things that could happen if you don't have the plan are what? You're not going to get the coverage you thought you were going to get, and you can't easily change that.
No, you can't easily change it, and you're going to have to work with someone. I'm going to say our counselors that we have at area agencies on aging that work with Medicare plans. They're probably going to have to jump in and try to assist that person. But I've also, now this is where I have heard real-time stories when I've walked past that counselor's office, and I can hear the person in person sobbing, sitting there with our counselor.
The person who should have Medicare, the proper.
Or the wrong plan.
And they can't get out of it.
Okay.
And that is heartbreaking because one of the things you need to make sure is your doctor going to be on the plan that you want? Is the local hospital, we cover a lot of rural area for WACOG. So there's not a lot of options like there would be here for multiple hospitals. There may be one hospital. Is that hospital on that plan? Are you on certain medications that you need to make sure are going to be covered? Or what is it going to cost you out of pocket? So there's variables that are specific to you. I want to keep seeing my doctor. I know what medications I currently take, but what could come on board. I want to make sure that if I have to go to the hospital, the doctors and the associations that are affiliated are going to be covered. And that can be done by somebody who will objectively sit down with you and review all this information and tell you about the plans that are available for the area that you live in, because the plans aren't the same across the state.
And that can be part of the problem, right? It's good here and not there, and you're sold the plan that's good there, not here.
And if someone's calling you from back east trying to help you with your Medicare plan, that's where they could genuinely make an error and sell you a plan that doesn't even exist in the county that you live in.
I mean, this sounds like a life or death situation in a lot of ways.
It has been at times, heartbreakingly, yes, because people who lost coverage and couldn't afford to carry on their treatment did not.
Yeah, and it's not like, because when I heard that story about the person that I think had cancer and couldn't get the coverage, I was like, oh man, there's got to be a way they can get out of it and prove that they were taken and get into something else. But it seemed like it was very hard to do.
Set in stone.
Once you're there.
It's a huge challenge. You really have to have someone that you can trust who will work with you, help make the phone calls, help with an appeal process. It depends on which plans. And that's why I always want to refer people to our experts. Listen, they have to go through training every year so that they know what the new changes and requirements are for Medicare and for Medicare Advantage plans, all of it. So they understand all of the components, and they understand the options, and they know what is going to be available and what has changed since the previous year. And that's critical. Who can keep track of all of that if that is not your area of expertise?
Sure.
So what are, we'll get into a few other things, but what should people be looking for now when it comes to Medicare? I mean, if it's first time enrollment, there's certain things they have to do. And then what after that? What are some things people need to think about?
So one, education is king.
Okay.
It really is. If you don't know anything and you are coming up on 65, you need to start educating yourself right now. Now, you can go to Social Security and you can go to the website, get your account set up, and start looking at the materials.
And you do that at Social Security, the .gov?
And the MyGov,
yes.
my.gov account, they're going to want you to have that set up.
Make sure it's .gov.
And you want to do that because you also want to be looking at your Social Security. If you're not taking it yet, you should be tracking what they say your earnings were for the previous year or previous years if you haven't done it yet, and see if you concur with what they're showing. But then you're set up and ready to go if you already have that online account ready. If you don't know how to do that, then that's your starting point. You're going to need to find that person that you can trust locally to work with.
Okay.
And ask for the assistance to get online and do that. Some folks don't have internet. Some folks don't have a laptop. It can be very difficult to maneuver something like this on a cell phone. Mm-hmm. So if you can't do it on your own and start educating yourself and become aware of all the questions they're going to ask, then you want to reach out and find that trusted source to have them start helping you. Open enrollment is October 15th to December 7th, but in our case, our counselors work year-round assisting people because questions come up during the year.
That's Area Agency on Aging, and
Correct.
They're around the country.
They are. There
Area
are
Agency
8 of
on
us
Aging.
in the state of Arizona, so we cover the entire state. Mm-hmm. And then across the nation, because it's under the Older Americans Act, is why Area Agencies on Aging exist.
Okay.
We can all have different names. We could be called by different titles.
Okay.
But if they'll just do a quick search for Area Agency on Aging in their county, they're going to be able to find who could be helping them.
And they can talk to someone on the phone.
Absolutely. In fact, we were just giving a presentation this morning from our organization to community members. They can, our staff works by phone, in person. They can help do the research. We'll send them, we'll mail the information to someone who said they can't travel anymore. They can't come into the office.
Not tech savvy.
So they'll work by phone, they'll work by mail, sending them information so they can make the decision and be ready. And then once they're ready, they can call back in and the staff can then assist them again to finalize things.
So can they can help, the staff can help them set up the account, or do they give them the information to do that on their own?
They can help them with setting up that account. Now, some of it's private, so we don't want them telling us the password they're going to choose.
Sure. No,
but we can help walk them through that process.
And is there a charge for the
No. That's the great thing about what we do. Again, this is mandated under the Older Americans Act. So this is legislated federally.
Yeah.
That we have, they're called SHIP counselors, and that's State Health Insurance Program. counselors. So they cover Medicare. They can assist with Medicaid for Arizona. That's Access and Altex. They also can assist with some of the other programs that tie into Medicare for low-income individuals. There are assistance opportunities for those that rank at low income to pay a reduced premium price. SNAP, food stamps, these programs that all tie in when you are Medicare age and low income, our staff can help with that as well.
Is there anything more that these people who are calling and selling these plans or the TV commercials and those things, anything more they can do for the person than Area Agency on Aging can do?
They can collect a fee, a bonus from the insurance company that they sold.
So nothing
the plan
really
for.
positive, then yeah.
No, as I said, if you have someone in your area, in your town, that trusted broker that you've worked with, that's fine. That's great.
You'll pay them though a little bit.
Well,
for
you're
whatever
not
they
going
do.
to pay them, but the insurance company that they sell the policy for is going to pay them.
Okay. Okay. So the recipient doesn't pay, but
they just pay for their Medicare coverage on a monthly basis.
Okay. How much these people? I'm fascinated. We'll move on. But the people who are calling and all, how much do you hear these people spending on it? How much are they making? I guess it's not the recipient that's paying it, but it is the insurance, correct? I mean, how much are they making by making the calls? You know,
I do not.
But they've
know,
got a commission, I guess.
Yes, it's a commission. So it's like any industry that pays a commission, whatever
Sales
the
position.
percentages are. Some policies and some companies pay higher commissions, and that's why there is a temptation for that salesperson to sell that particular policy under that company because they will make more.
Okay. So you can look for reviews, I guess. Go to bbb.org. They might be registered there. If your Area Agency on Aging would be the place, but if not, look there to see what the reviews are. Look for complaints against whoever this is. Find out what the business name is.
Right.
I guess that's. We were going to get into a little bit of like what. So we talked about, which I'm almost at that point, but things that people need to do who are 64 right now. And you said that. I don't think we talked about that. We talked about this off camera, I think, but Plan A. It's important that they.
You must sign up when you turn 65. You have 3 months prior to turning 65, the month that you'll turn 65, and 3 months after you turn 65, that you must sign up on Medicare and at least select Part A, which is hospital coverage only, and it's free.
Even if you're working and have your own insurance.
Have your own insurance, you still need to do it.
And if you don't do it, go ahead.
If you don't, and you don't have like some folks just say, oh, I just don't need Medicare. I'm healthy. I'm fine. If you don't sign up during that window, you are looking at paying a penalty for coverage when you do decide to sign up. And that penalty is, I believe it's currently 10% of the premium that you would pay monthly forever. Wow. You will always pay that penalty going forward. So you do not want to wait. It does you no harm to get it set up, and just select the hospital coverage if you already have other coverage.
You're not paying anything.
You're not paying a single thing. You're just going to go through that process of acknowledging, yep, I'm 65, I'm signing up, I don't need to choose any other coverage other than hospital. They're going to ask you why, and you're going to tell them, I'm covered by my employer or I'm covered by my spouse's employer. And you're going to give them that information, and then you're done, and you're going to get your cards in the mail, and you're going to get information for a while because they're going to want to make sure you didn't make a mistake. So you'll get follow-up information saying, you didn't select anything, and do you want to select something? Because they want to make sure, they are trying to make sure that we don't make errors. This isn't a gotcha. It's just there's a process, and we must follow it.
Yeah, and a lot of people wouldn't know about it, I think, otherwise.
Yeah.
I don't think I would have known if I didn't work where I work.
Yeah.
When my mom, we moved my mom from California at one point to where I live in Arizona. We needed to take care of her. And the first catastrophe that happened was I did not know that with her Medicare coverage, her supplemental policy would not cover her in Arizona. She immediately lost that assistance. And it was roughly around spring, March, April, we moved her. So until the following January, she had no supplemental coverage. And we had to figure out how to pay for everything that would have been covered under that extra coverage.
Man.
And it was
Substantial.
It was very, very difficult.
Yeah.
And that can happen to people. I didn't know. If I would have known that, we would have had to have a talk about what is the best time to move mom over and make sure that
Right.
we're not going to do any harm with things such as this. So learning in the midst of it when you've made a mistake is costly, it's painful. You feel like you've let your loved one down.
Sure.
And so, again, go back to education. We need to know for ourselves. We need to research in it and be educated and understand the process. Find trusted resources that you really can reach out to and utilize. And please, 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 here's where I get on my soapbox.
Yeah.
I promise you that whoever is sending you that postcard, that mailer, that invite to a free dinner, that commercial, and I don't care how cute the person is in the commercial and the message or how funny it is, the radio message, you don't know them and they don't know you. And why would we want to trust somebody just because we received something in the mail or we heard a message on TV or on the radio or we get a phone call? You know, you don't have to answer a phone call from a phone number that you don't recognize.
Man, I didn't know that.
Man.
I've never
That
told
is
anybody
that is tough.
I've never said that to
What
anybody.
if it says possible scammer?
Exactly.
You know?
So please don't consider that your first
man,
line
you-
of defense
Yeah.
to search out for help for this coming year. And please don't disregard checking into any updates you need to make. You know, policies change, coverage changes, doctors decide to no longer take Medicare or take Medicare under the plan that you had. So you can't expect that everything will stay the same. A lot of folks are tempted, I don't want to do it. They'll just leave it alone, leave it as it was from the previous year. And then the coming year, they find out, oh my gosh, I just lost my doctor. They don't cover this medication anymore that I was taking. So you still want to check into it. You're already on Medicare. You loved your plan. You think it's great. You need to find out if anything's going to change for the coming year so that you don't find yourself stuck.
Yeah.
And you could have been on a different plan that works better for you.
Yeah, well, it's like any healthcare, really, because they
Yeah.
offer these new plans for us, even looking at them to see, what they are and the deductibles and all. Anything else? I kind of want to wrap it up here because you've said a lot. Are there other things that are important? We talked about how to find a place to help you. Are there other questions that you should ask about your Medicare? You went over a lot of this too. About your coverage, are there things that people need to be thinking about right now? I think you said your doctor, are they still covered? That hospital near you, is it covered? Are your medications covered the way that they were?
Absolutely. If you're in the middle of treatment, if you make a change, will it interfere with that treatment?
Oh,
Do you have to stay on the plan that you're on because that plan will cover that, even if it's perhaps not going to be the best plan for you? It's the plan that's going to continue your treatment. This is why you really need a trusted counselor to talk to where they're going to work through all of this with you. They're going to look it up, research it with you, give you your options and tell you. SHIP counselors have the ability to get on and look at a formulary. They can see the medications even that you're on, plug them in to see if, will this plan cover this? Will this cover that? They can verify that for you based on that information for the plans available.
These other brokers won't be able to do that.
They
right?
they
Or
they
can they?
can if they are certified to sell Medicare coverage. Yes,
They could.
They could.
Yeah.
they could.
Yeah.
Some are going to be very
some could be-
forthright and
Yeah.
and they're great brokers
is-
and they're going to
Sure.
do a fabulous job.
Yeah.
It's just it's hard. Human nature. You put the temptation of money in front of someone and that's tough.
Mm-hmm.
If you know you're going to make a better or you just came on board as a new salesperson and you're not as familiar as you really should be, think about what it's like for them. The first time you're trying to sell these products, it's overwhelming to try to keep
How
track
many
of
plans
all
are
of it.
there? How many different plans?
It depends.
Dozens, I would guess.
Well, there
Options.
are. It's just, think
From
if it's a
various
broker
places,
from out of
various-
state
right.
that covers multiple states,
Yeah.
how many plans is it? And can you get mixed up with what the coverage is from state to state?
So just make sure that you really do your research if you're going to pick a broker, because we're not saying the whole industry is bad. It's just
Right.
like,
No,
really,
not at all.
They really can help people. I think
There's
my
some
wife used
fabulous
a broker.
people
Yeah.
out there. They do a
Yeah,
great job.
jobs, but
It's best
Yeah.
if you know them, or you can get a referral from someone. We do work with brokers because our ship counselors, there's certain types of insurance that they can't actually finalize the process, but they have built relationships with trusted brokers in our region that they will refer the client to finish steps on, especially under Medicare Advantage or some elements. Sometimes there's just some specialized assistance that person needs that a broker is going to have to do.
Okay.
But our ship counselor knows the brokers that they've worked with for years and years and years that are trusted and are going to do the right thing for the person. So again, it's finding that starting trusting individual or entity to start this process that will walk you through it all the way to the end until you're enrolled and ready to go for the next year. And you can do this over and over and over again. It's not 1 year you go see an area agency on aging Medicare counselor. We have folks that have been doing this for years with our counselors, and our counselors have been around for a very, very long time.
Okay.
Lots of times, I'll tell you, this is a funny story, but this is how connected they get. We have many single older ladies who would really like for our counselor to not be married because they would like to marry him.
I see.
They
Oh
love
my
him
gosh.
so much because
You say
they
him,
knew they
so there's
could trust.
somebody. There's one person.
They trust him. He's been in their lives for years,
Yeah.
looking out for them,
Is his
advocating,
name
making.
Don?
Nope.
Don Juan?
No, but I bet they think he is a Don Juan. But
That's great.
to have that kind of relationship where you've met with this man for,
Yeah.
even up to a decade,
Yeah.
Sure.
you can
Yeah.
trust him.
They're ready to take it to the next step.
That's what you want. You want to
Let's
work with
talk
somebody
romance
you trust.
scams. It suddenly got into romance scams now. All right. Hey, Carol, that was great. Thank you very much.
Thank
That's Carol
you.
Brown with WACOG. WACOG stands for,
Western Arizona Council of Governments.
all right, Area Agency on Aging as well. And you can find Area Agencies on Aging online.
Yes,
Right?
absolutely. Just
And-
do a search for your county, and you're going to find the one that covers your area in the state.
Okay, that's great. Anything else, Michelle? We good?
Oh, thanks, Carol. That was great.
Yeah, and
Thank
if you're a family member, I think also of a senior or a friend,
Absolutely.
talk to them about that because this is the time, right? All right, get involved. All right, that's it for us. We'll see you next time.